My first speech-language pathologist position was out in Saskatoon at the Saskatoon City Hospital in the Adult Speech and Language Center. There, I treated clients with muscle tension dysphonia, and I learned tons and tons of amazing information from my mentor, Christy Ife. She's been in that position for years and years and years, and I was honored to be able to cover for her while she was on a little break. So I got to learn all of her best tips and tricks for how she treats muscle tension dysphonia. Most of what I learned from voice therapy was from the materials that I acquired from her. So I wanted to share with you some background information on what muscle tension dysphonia is and what we can do about it. Muscle tension disorders. Dysphonia is the term we use to describe an abnormal sounding voice. Functional dysphonia means that there's nothing wrong with your actual anatomy, but your voice quality sounds different either because of stress, psychological disturbances, or muscle misuse. Let's go through the symptoms of muscle tension dysphonia, or MTD. Life stress and psychological conflicts. A lot of people hold psychological tension in their throat. I know I sure do. When I'm feeling emotional and trying to hold back tears, I almost feel like my muscles in my throat get cramped. They're tensing so hard. Aphonia means you're trying to make a sound but you can't, or dysphonia means the sound is abnormal. Breathiness, hoarseness, referred pain in your ears or in your chest. In another video, I explained how this group of muscles is like a spider web. If there's tension in one area, there's tension in others. That's why we relax the jaw, the throat, and the chest for voice therapy. Another symptom is excessively high pitch. When your muscles are working too hard and too tense, your voice quality might sound a little bit higher than it's supposed to. You might experience muscle cramping in your throat. You may have spontaneous pain in the region of your throat or larynx. You may have the sensation of a lump or tightness in your larynx or your pharynx. You may experience tension in the tongue. You may find that rubbing or kneading the muscles helps relax them. You may feel that if your muscles are tight, your larynx, your voice box, your Adam's apple is actually higher in your throat than it's supposed to be. You may find that swallowing water helps reduce tension. You may experience pain in response to pressure applied to your larynx. And you may notice that with a few simple vocal warm-ups, stretches, and massages, your voice quality already starts to improve. Actually, I have one client where I taught her these stretches, massages, and vocal warm-ups. And when I saw her 2 weeks later, even though she hadn't been extremely rigorous in applying the strategies, her voice quality already sounded much clearer. Factors that exacerbate muscle tension dysphonia include stress and psychological or personality factors that tend to induce tension. If you're a perfectionist or a type A person, you may be prone to a little bit more tension. Now, this handout says GERD, but we've talked about how laryngopharyngeal reflux, LPR, is the one that comes up to the level of your throat and impacts your voice. Sometimes people develop muscle tension dysphonia after an upper respiratory tract infection. This makes sense because when you're sick, you have a lot of coughing, which results in swelling of the voice, which results in breathiness or hoarseness, and people try to strain over that and develop muscle misuse. It may be compensation for an underlying disease, or it could just be technical misuse of the vocal mechanism in the context of extraordinary vocal demands. If you are a person who has to talk every day, all day, but you're not using appropriate vocal technique, you could develop muscle tension dysphonia. Teachers often have to take time off work either due to laryngitis or other voice-related issues. The voice is their main tool that they use. Same with me. I communicate every day, all day. If my voice isn't sounding great, I can't really work. What causes muscle tension dysphonia? Vocal abuse, which is any behavior that injures the vocal folds. This includes yelling, screaming, or cheering. I've discussed in our vocal abuse and vocal hygiene video that there are many great alternatives to making lots of sound without the source of the sound being your voice. Some people have strained vocalization or excessive talking or frequent use of those hard glottal attacks. See my video for easy onsets and linking, but essentially it's I eat apples always. Excessive throat clearing or coughing slams our vocal folds together. Inhalation of dust, cigarette smoke, and noxious gases irritates our vocal tract. Singing with an inappropriate vocal technique or under abusive environmental conditions. Speaking in an abusive manner while vocal folds are in a weakened condition. That's why when you have laryngitis or you have a compromised voice, do not try to force your voice. You could develop really bad habits that lead to muscle tension dysphonia. Also, vocal abuse can lead to other vocal pathologies like nodules, which we will explore in another video. Vocal misuse is the improper use of voice related to pitch and loudness. So if you are squeezing too much here to get loud instead of using appropriate diaphragmatic breath support, or if you are squeezing too tight and you are constantly putting on false voices, whether you are a voice actor or whether you play with children a lot, if you are putting on these false voices chronically, that can lead to muscle tension dysphonia. I worry about Marge Simpson. Vocal misuse can also lead to other vocal pathologies. And stress or psychological issues can cause muscle tension dysphonia. Many occurrences in life can lead to emotional and physical stresses that provoke voice disorders in some individuals. Unknown by these individuals, these stressors can often lead to extreme muscle tension. In some clients I have seen, every single one of these causes, vocal abuse, vocal misuse, and stress or psychological issues, contribute to their voice disorder. An ear, nose, throat doctor, ENT, or otolaryngologist, makes the diagnosis of muscle tension dysphonia after they visualize it. They can either go through your mouth to look down at your vocal folds or flexible nasendoscopy. They stick a camera up your nose and look down at your vocal folds to watch them vibrate. When I was working in Saskatoon, I used to attend clinics with an ENT and Christy Ife, my speech language pathologist supervisor, and I actually got to participate in MTD assessments. This means I got to watch the nasendoscopy happen, and the ear, nose, throat doctor and Christy Ife would ask the client to do vocal exercises so that we could actually see and visualize what was happening in the larynx, and I could actually physically see the excessive muscle use. It was really neat. I actually had it done to myself, but I am so sensitive in my nose that I just couldn't stop crying. The tears were streaming down my face, and I couldn't actually see my own vocal folds. However, I was told that I have some degree of muscle tension, which makes sense because historically I've been an anxious bear. How do we treat muscle tension dysphonia? Voice therapy includes 4 major components, which I have mentioned already in other videos. Vocal hygiene, go watch my video on that. Vocal production, so we analyze what is your current conversational pitch? Is it appropriate for your age and gender? How loudly are you speaking? What does your voice quality sound like? And how can we make it better? Respiratory support, I have my whole video on correct diaphragmatic breathing and how I teach it to support speaking. And muscle relaxation, using the muscles in a relaxed manner. You can watch my videos on stretches, massages, and vocal warm-ups for details. To help myself with learning these concepts, I am a visual person, so I found some diagrams that we'll go through together. This is what your larynx looks like if you were to cut your head this way. So looking from the back forward, this is your epiglottis, which is a flap of cartilage that folds down over your airway to protect it when you swallow so that food and liquid don't go down into your lungs. That's your epiglottis. Did you know that we have false vocal folds? These ones are ventricular vocal folds, are not supposed to touch, they are not supposed to vibrate. Underneath your false vocal folds are your true vocal folds. Over here, this is the view that we can see through nasendoscopy. This is the back of your throat, and there's little lumps of cartilage here called the arytenoids. These bands here are the true vocal folds. These fleshy lumps over here are the false vocal folds on top of them. And back here is actually the front of your neck, and that's your epiglottis, that thing that folds down over your airway when you swallow. In this picture, the vocal folds are open. So this is when we are breathing. Your vocal folds are open. And when we make our voice, our vocal folds are closed and air is pushing through them and they are vibrating. And that's what makes our voice. Here are the sources for the images I obtained. Let's go into what does it actually look like. There are 4 different muscle tension presentations that I know of. The first one is anterior posterior squeeze. So your voice box is being squeezed from front to back. And this is often due to emotional stress. It often occurs from speaking too low in pitch. This muscle presentation is called the muscle tension gap, where the muscles work against each other, pulling in opposite directions. You can see there's actually a physical space in between the vocal folds. That's far too much space. That's going to let far too much air come through, so your voice is going to sound breathy and quiet. That is commonly associated with psychogenic conversion dysphonia, meaning your emotions result in excessive muscle tension, and it's it's very difficult for you to get a clear, loud voice quality. This presentation, the supraglottal adduction, means that the sides of your larynx are squeezing together too much and your false vocal folds come into contact. This presentation is often psychologically based. And this one, the posterior glottal chink, I mentioned this in my video about vocal hygiene. Your voice sounds breathy because of a gap where the muscles pull the vocal folds apart, and this is commonly due to muscle misuse. It's an extremely tense position because some of your vocal folds are touching together, but at the very back, they have to oppose forces and hold that position open. That's going to leave a lot of air leaking through. Hello, my name is Jessica. When we whisper, that's a posterior glottal chink. Regardless of how your muscle tension dysphonia presents, it is all due to the over engagement of muscles in your jaw, neck, and chest. This is why therapy for muscle tension dysphonia consists of stretching, muscle relaxation techniques, using proper breath support, and resonance to improve your voice quality. Knowledge is power. It helps us make informed choices so that we can do what's best for our voice. Thank you so much for your time. Let's go get relaxed.